and we're now going into the nitty-gritty details of what to do when a patient comes in, how to actually diagnose. So the defining symptom of chronic fatigue syndrome, myalgic encephalomyelitis, CFS-ME, is post-exertion malaise. This is the defining symptom. It's not exercise, post-exercise malaise, it's post-exertion malaise. So if people do exercise and they feel a bit better for doing exercise, it doesn't mean they haven't got ME. And often people feel, you know, they do a bit of exercise, they feel good, they feel they've done something, and but if they overload the body, then it's the exertion. It's doing too much. They find afterwards the symptoms come, and they don't come straight away. Sometimes it's not instantaneous. Sometimes it is, and most often it is, but sometimes there's a delay. And as we'll see, that it can be up to 3 days post exertion that you get the symptoms. So that's the main symptom. Then we talk about general abnormal muscle fatigue that occurs after relative mild activity. That's a very common symptom. Difficulty getting to sleep. And we talked about that yesterday. Why? And that was because of the hypothalamus locus coeruleus axis not switching off. So it switched on, and it keeps them firing off, so that there's noradrenaline being produced, norepinephrine being produced in the brain, and it makes them wired and fired. Do you remember that yesterday? Yeah. And that's what's happening. They find it a lot of them find difficulty getting to sleep. Sleep disturbance, which includes insomnia, but there's sometimes hypersomnia. Sometimes people are sleeping all the time, but they don't get deep sleep. They get lots of alpha wave sleep. They don't get the deep delta wave sleep, the deep restorative sleep. They get the alpha wave. So they sleep all the time, but they don't feel refreshed because they're not getting this drainage. Vivid dreams, do you remember? And sometimes very weird ones. Do you remember that? We talked about that yesterday, the thalamus. The thalamus gets affected, which it does when the toxins, we saw this in their first study by Iliff and Jeff Iliff and co in Rochester, where the toxins, where they stopped the drainage of this was dealing with beta amyloid when they were doing research into these mice, but they saw that the thalamus got congested with the fluid, and so toxins would drain backwards and hit the thalamus and the basal ganglia first, and this causes vivid dreams, okay, and very weird ones sometimes. So that's a very common symptom as well.